due to COVID lockdown, there is a mental breakdown among students, especially medical students. How do you think to overcome with that laziness and cope up with schedules, sir? What do you think we can do to overcome with that laziness, sir?
Okay. Basically, after this COVID lockdown, the thing is that you are entering into the what to say the postings and classes, and it's something again a new. We are starting new a bit, and it would be a bit troublesome because anything we get adjusted for too a long time will not be able to come out of it easily. We call it a zoom in and zoom out theory. As we have been zoomed out of medicine for some time now, zooming in might be a bit difficult. I would advise my fellow students, my fellow juniors, this is the right time because we are not sure how when will COVID third wave will be coming. It will be coming or not. Is it nearing in the January or not? We are not sure. Only thing we can do is we can just pray that it's going to be a delay or it doesn't come at all. So whatever time that is given now, every day counts. So try to make use of this time. Yes, you were a bit in the home, you were a bit in your Zoom classes where you were just chilling out. It was nice time. But this is the time where you're going to enter into the hospital setting, where you're going to again go into the postings. This is the advice that my sister gave. She's also a doctor from Stanley. She told me that you can bunk internal exams, you can bunk theory exams, but do not bunk clinical postings. Somewhere that advice stuck into me, and somewhere I thought that clinical postings is very, very important because that's where you tend to know what the subject is. As I started practicing from 2013 to 2021, I have seen a lot of big shots, okay, so-called high money people who are really popular in the society, who are super rich, but with long faces, who are having depression. It's either because of two things. Either they have too much stress to handle, or it is that they do a job which they don't like. As we medicos, this is a time where we go into the postings, see cases, like get exposure, and we try to decide what we are going to choose in the future career. I think it all starts from the second year. Go to all possible postings, go and see all possible cases, interact with all possible faculties. They might be busy, they might be seeing, there might be surgeons, there might be physicians, there might be radiologists, they might be busy actually, but they will definitely be happy to help you if you're really interested, if you're really keen. Talk with them, understand what is the subject. Why I keep on saying this is that, to my fellow students, is that actually I didn't read too much of psychiatry when I was a UG student. But when I somehow got interested when psychiatry UG classes happened, and most importantly, what made me attracted towards psychiatry was patients. The patients that I saw in my psychiatry UG posting in my Trichy Government Medical College, and the way the professors saw the patients, the way the patients threatened the faculties, they used to threaten that they are going to kill the doctors. Somehow I felt that this is not a usual clinical posting, and I felt it was nice. There's a only department where I wrote the logbook daily. So that's where I got the interest, and it gave me the confidence that yes, I should take psychiatry, because psychiatry is still with the stigma in 2021. So if you want to take psychiatry, the family will say no, the friends will say no. But when I boldly took a decision, I think that is the best decision that I've made in life. As you're all going to be surgeons, physicians, radiologists, non-clinical specialists, I would like you to go into the specialty, see what is happening, get as much exposure as possible, talk as much with the important faculties, get involved there. Because once you choose a profession, once you choose the branch of science as a specialty, you will not be able to come out. So you do not read daily, or you do not go to theory classes daily, you do not go for Zoom classes, which is like programs that is summoning CME and all stuff. But only one thing that you have to do is go to your clinical postings regularly. That's the first step out of your laziness, because you might not realize what is it going to give to you in your life now. But I have seen people seeing that. Thank God I attended the surgery posting, because I knew that I have an interest in surgery. As like me, I attended the psychiatry posting, I had the interest. So try to go to the posting, see as many cases as possible, try to find which suits you better. Okay, there is n number of branches. Try to fix there. Don't get fixed to one particular thing. Have plan A, plan B, plan C. Talk with all possible faculties. Interact with a lot of patients. Try to see what is happening as a prognosis, future. Then learn something about it. Then fix a career. I think UG is not for reading. UG is getting exposed. UG is to find out what is a branch of medicine that you want to live with. No, doctors don't get retired at all. Till the last day of your life, you'll be practicing. So you need to choose a branch which will be the best for you. It's not which is going to give you too much of money, but which gives you the passion, which gives you the aha moment. Even now, when I see personality disorders, even now when I see students with depression, even now when I see early onset schizophrenics, and when I'm able to diagnose it, that somehow gives me a kick. That kick should happen. I have seen my fellow students or fellow friends who are surgeons who still have the happiness when they come out of the theater. Okay, please use this 4.5 years or the next 1.5 years with getting exposed, trying to sort out what you're going to fit in. Because preparing for NEET PG and preparing for your next, if it is not a very big job, because I am taking classes for students who are NEET preparing and also for INI CT. I know it's like it's just sitting and preparing, but this is a time where you get exposed. And if you are lazy to attend classes, don't attend. If you are lazy to attend CME, don't attend. But never ever cut down your clinical postings. That's my humble request. It's not advice, but just a request. Thank you.